Hi, my name is Dr. Danielle M. I'm the Chief of Surgical Oncology at Harbor UCLA Medical Center. The case we are doing today is a 62-year-old African-American female with more than 30-year history of a toxic multinodular goiter. She had chosen medical therapy for many years. However, due to the enlarging size of the thyroid and compressive symptoms, she opted for surgical intervention at this time. She was consented for a total thyroidectomy. Before we begin to make any incision, I just want to go over a couple things of some of the equipment I like to have for these cases. So for all of these cases, I like to use the laryngeal nerve monitor. So we have the nerve probe set up. For this case, I prefer the needle point Bovie. And for a vessel sealing device, I like to use the handheld sonicision device just because the tip is a little more narrow than something like the handheld harmonic or the ligature. And it's also cordless, so it keeps out of the way. We're going to begin. As you can see, this woman has a very large goiter, which requires a significantly larger incision than we typically use for a thyroidectomy. Her landmarks kind of obliterated by the mass. You can see this is her clavicle here. The midline is deviated. Again, when you have such distortion from this, it's kind of an estimate as her trachea is already deviated on the CT scan. Her trachea actually comes about like this, with significant displacement of the vessels on the left side, where this outpouching of this goiter is actually splitting the carotid and the interjugular vein. She's likely going to have a lot of excess skin that we'll have to excise later once we take out all of the goiter. So she has a nice crease here, but this is a bit too high, so we're going to split the difference. Typically you'll do 2 finger breaths, which is in her about here. So what I like to do when there's no crease, natural crease, eventually we all have our creases, they typically run parallel to each other. So you can see one down here for her and one about here. So I kind of use that as a guide to map out where I will make it as a guess of where her next crease may come. So I always like to make the line a bit longer than I'm actually going to use ideally, so in case we have to extend it once we're open, we know where we would like to go as a target. So typically, even in moderately sized goiters, 8 centimeters has a tendency to be enough, but in her, as you can see, that doesn't even get to the lateral borders of this, so I think we'll start with about 12 and go from there. You can always make it bigger. All right, we'll make the incision. Anesthesia.